Next up is VC panel. Being active in Japan, realities and opportunities. The last session of this 2-day symposium. First, let me introduce the speakers on the stage. We are pleased to have Dr. Robert Weisskopf, Senior Partner at F Prime Capital, who will facilitate the discussion as a moderator. The panelists are Dr. Jonathan Ye, Managing Partner of Saisei Ventures, Mr. Ken Hong, Managing Partner at AN Venture Partners, Dr. Makoto Ohori, Partner, Chief Investment Officer, Life Science of U Tokyo Innovation Platform, Mr. Shinichiro Komoto, Partner at 8 Rose Ventures Japan, Mr. Tai Harada, Partner of Fast Track Initiative, Mr. Takeshi Takahashi, Managing Director of Catalyst Pacific. Lastly, Mr. Taro Inaba, Managing Partner at Remiges Ventures. Now, Dr. Weisskopf, the floor is yours.
Thank you for the introduction, and thanks for the invite. So I have it's somewhere between the pleasure and the responsibility and the impossibility of introducing the last panel. So of course we know this is the last thing between you and fresh air and walking around. It's also the largest panel and the shortest time. So I think we have a lot of responsibility. And I would say in distinction from the panel yesterday of the global VCs, this is actually a group of people who now have been spending years or decades actually trying to work within both the Japanese ecosystem and then translate it across the world. And so I think everyone's going to have something interesting to say. And maybe what would be useful in a short period of time is just to go maybe across the room. I'll start with myself first. So F Prime, which you people may or may not know, is a US-based venture capital fund. It has many verticals, but I'm senior partner in the healthcare group. We're investing out of our 9th fund, which is a $500 million fund. We invest internationally, primarily through our colleagues at 8 Roads, which is we think of as our sister fund. So I've spent more than a decade coming back and forth to Japan. So I've got a lot of experience in, I would say, seen amazing growth and just lots of changes even in those 10 years. But I also have spent time in China, spent time in India, and have kind of an interesting perspective on the various parts of the world. But maybe we can just go across, people can introduce both their funds and maybe in the context of that, just talk a little bit about how you think about the kind of the very specific aspects of trying to create a fund that's useful and focused on thinking about how you go across, in particular, the Pacific.
So hi everyone, I'm Jonathan Ye, Managing Partner at Saisei Ventures. Thanks for the organizers for the invitation. Our Saisei Ventures is a US-Japan venture building venture capital fund, primarily focused, or at least historically been focused in advanced therapeutics, like cell therapies, gene therapies, and RNA medicines. We're emerging managers. We're operating out of our first fund and raising our second fund very soon. And our investments have spread across the United States and Japan as well. Our approach is perhaps a little bit differentiated from some of my colleagues here, where we are trying to build in Japan as much as possible, but kind of spreading teams across Japan and the United States. I don't know if you wanted me to talk now about the thoughts on building, but maybe just continuing with the introductions?
Yeah, why don't we continue with the introductions and then go from there.
Thank you, Rob, for moderating. Thank you to the organizers for having me. My name is Ken Horn. I'm the managing partner at AN Ventures. We are a cross-border fund specializing in finding opportunities in Japan, whether academic spinouts or big pharma spinouts or anything in between. Our first fund of $200 million closed last year. We are actively investing, and I guess touching briefly on the cross-border, I hope people who are doing cross-border are able to bring value and build bridges as opposed to just capital, and that's something that we strive to do as a fund.
Hi, my name is Makoto or Mark Ohori, partner and CIO, Life Science Investment in U-Tokyo IPC, which is an investment for the University of Tokyo. And we are early stage biotech investor and company builder and investing in both in Japan and globally. Our approach is science-driven, globally oriented, and ecosystem connected, Japan ecosystem and the global ecosystem connected. And first, we are fundamentally a science-driven investor. And second, we are deeply connected to the Japan ecosystem. And third, we operate with a global execution mindset, which is our policy for the global investment. We already invested in 8 US and the UK companies. And I'm looking forward to speaking with you all.
Great meeting of you. Again, my name is Shin Komoto from Eros Ventures, Japan. So I am responsible for Japan fund, but within the franchise, we have a China fund, India fund, UK fund, and also F Prime in the United States. So combining all together 4 funds, I think we are close to 40-50 venture capitalists in the healthcare segment, which is one of the largest global venture capital focusing on the healthcare. And I wish to deliver more interesting technologies and seeds of the investment to all of you in this room or the participants online. Thank you.
Hi everyone, my name is Tai Hirata, partner at Fast Track Initiative. About Fast Track, we are a Japan US venture capital firm, myself based in Boston, and then so we have offices and activities across Pacific Ocean. So we've been around more than 2 decades in Japan. Yeah, and probably that is our uniqueness as life science focus fund. Yeah, and when we started, I'm newer partner than my colleagues. When they started, there were not many biotechs in Japan, and then so as the get-go, we've been building companies, and then because that is the only way to invest biotechs. And then our model from that mindset of creating companies is that really going inside academic of Japan and then working side by side with PIs and then help them create companies and operationalize and then gradually move it forward. And then many of Japanese sciences are quite early stage and new biology, and then really going into the early stage and then help them is our model.
Hello, my name is Takeshi Takahashi, co-founder and managing director at the Catalyst Pacific. Catalyst Pacific is a life science-focused venture capital fund founded in 2019. And we set up to build a team globally from the beginning. So our team was split 50-50 between Japan and the US. And we try to, we have 2 strategies. One is we source the asset out of Japanese pharma or a biotech and then build a new biotech company in the US by leveraging the US ecosystem, including the talent and capital. On the flip side is we source the approved asset in the US or Europe, and then try to develop the compound for the region in Asia, usually excluding China. If that's the case, we built the company in Japan and then bring in the local talent and also bring in the global capital for the patient in the region. Thank you. Looking forward to discussing further today.
Yeah, thank you for giving me opportunity to join this panel. My name is Taro Inaba, founder and managing partner at Limitless Ventures, which is right now 12 years old venture fund I and my colleagues created back in 2014. And right now, we have 15 members across the Pacific Ocean. And we are raising our third fund right now, trying to do the final closing next month. And our uniqueness is that we try to do the translation work for university science in our in-house incubator comprised of our employees. And we are creating a sort of entrepreneur independent model because Japan has been suffering for many years for the lack of entrepreneurship. And we thought we should create a kind of an institution where we can do the early work like data validation and the translation of science into product. And when the product is ready, we create a new core, perhaps together with our friend co-investors in Japan or US. But the core essence is that we try to create a system where this translation work happens in Japan, and that this translation engine can grow. Our vision is that in the future we hire something like 300 employees for the translation engine, so that Japan can continuously, export great, scientific invention to the global market.
Thank you.
Nice to see you all.
Yeah. Well, maybe we can start with. Everyone talked a little bit about their theses and how maybe the funds think about what they find attractive, but maybe it might be, and I think we probably all have a similar thesis. There's obviously great science in Japan. There's great medicines that have been invented in Japan. There's a difficulty or a translational step that I think we're all kind of built to try and address, which is whether a combination of things. There hasn't been an entrepreneur class in healthcare like there has been in tech. There hasn't been a lot of success cases for people to learn from. And in many ways, I think we all have different approaches to try and address that. But maybe, especially, we might come back the way, in the direction we started, going the opposite direction, because I think the duration that people have been investing in Japan kind of does come back this way also. Maybe talk a little bit about what's been working and what hasn't been working, and maybe how you've changed the plans over the last, call it, 5 years.
Okay, did you mean that I should start? Right? Yeah. So, we have been doing this, company creation already for 20 years. Yeah. And something we see very positive these days is that, awareness of this system or creation of company increased dramatically in the Japanese market. So literally every scientist or researchers know about, creation of biotech or commercializing their invention. For the sake of saving patient, So 20 years ago, when I visited university, I was not able to see professors. They are thinking that I'm, salesperson trying to sell some investment product. And I have no opportunity to speak. But these days, everybody welcomes VC people. Thinking that there could be something we can do together. And something that didn't happen is that I thought more rapid creation of biotech ecosystem would happen over the last 2 decades, but it hasn't happened so rapidly. It is happening slowly, growing slowly compared to other territories in the world, like Europe, which grew very nicely over the last 15 years. China also grew amazingly over the last 15 years. So, but I believe that Japan is coming to the stage where kind of expansion of this industry happens. So I'm not so pessimistic.
Yeah, no, go ahead. I was going to say, so is there anything? How about? So it's a very long arc. Anything different, maybe even in the last 2 or 3 years? Or do you feel it's accelerating? Do you feel like you're hitting a wall? How does the environment feel to you as it's been evolving?
Yeah, I think over the last 2-3 years, the quality of a new company or company's asset increased dramatically. So I'm very optimistic about the takeoff of this industry in Japan.
Yeah. Thank you. So Takeshi, I think that's a model that at least in the U.S. Catalyst Pacific is I think kind of recognized as one of the groups that's been, incredibly productive in bringing assets from Japan. Maybe it's the same question. Has the thesis changed at all in the last couple of years, or how do you see it evolving?
When I speak with the Japanese pharma and also the biotech, back in 2019 or 2020, people in the industry understand the new biotech is built by VC in the US. But it's hard to inform them that how actually build a team and how actually run the company with such a small number of people. And now they understand the benefit of biotech, meaning it's different business model as compared to the big pharma. And then the biotech focus on some specific asset, and then very capable drug developer really focus on a single product, and then try to bring the science to patient as soon as possible in the most efficient manner with a passion, right? So that kind of a business model really works globally, and then now people recognize the benefit by partnering with a biotech or VC or biotech.
Yeah. I mean, one of the things I and I would even make the observation from a lot of the meetings I had today, it is still a lot of, I think, nascent Japanese entrepreneurs still think technology first as opposed to patient first, or what the unmet medical need is, or are we ready for translation? And it's nice to see it starting to pick up in awareness, just like the model, you have to pick up in the awareness. But I mean, it is an evolution that seems to be going slowly. Tai, how have things changed for you guys as you've, again, there's a long track record, so how has it changed in the last few years?
Yeah, I want to mention 2 points. One is about team formation. I think maybe a lot of us can agree here. But nowadays, I think in biotechs in Japan, the management team are thinking to get some part of the team members in the US. Maybe CXO level, maybe advisors, maybe consultants, or maybe other kind of helpers. But I think internationalization, international awareness is going more and more important. And by the way, I think this is not only Japan. I think all over the world. As a person, I also invest in US side of companies. And my portfolio company in one company in US side has offices in Boston and Germany, and Germany has bigger team. And then this international collaboration inside one company is really a theme all over the world. And I see that in Japan as well. So that is definitely one theme. And then also want to add one more, the other side of a spectrum of innovation, which is LP side of capital. We raised $130 million fund last year. And then most of the investors in this fund are institutional investors. And then my colleagues tell me that but when we started 22 years ago, not many or quite limited number of institutional investors were investing in biotech. So nowadays they're thinking about biotech investment is changing, and then biotech is an investable asset class from their view. So I think from that angle, capital is coming in, and then also the ground level team is boosting up themselves with international capabilities. What we see on the two different sides of the spectrum.
Great. So, Shin, what do you think are the biggest challenges, as you've now had 10 years looking at it in the Japanese side?
Obviously, the shortage of talent pool is the biggest issue, and followed by, I think, the weakness of the capital market. So the talent pool is, we have done a quite number of company creation in Japan, or straight investment to the early stage or preclinical or clinical stage biotech in Japan. Also, we have done the company creation in the United States using the Japanese technologies or some sort of things. We have learned that the speed and experience to develop the programs globally, which is quite important factor to be valued or appraised by the investors high, as a corporate valuation. But those talent pool is very limited in Japan, and versus US or other geos, there are a lot of talent pools I found. So it's kind of the way forward for us is to leverage Japanese science and leverage the talent pool outside Japan to build a product to deliver the solution to the patient.
Yeah.
And about the capital market, so we have experienced a couple of the IPOs, and Japanese capital market is mainly consisting of the retail investors, individual investors, I mean, and a very shortage of the institutional long-only investors looking after the Japanese market. So, the IPO is meant to be the path of the fundraising, not the exit event for the company or venture capital. But most of the companies in Japan couldn't raise enough money through the IPO in the market.
Yeah. So actually, I had two questions and you can go first how things have changed. But you've also seen, I think, venture capital done in Japan in kind of very different places. So over a longer period of time. So maybe you could talk both about how you think University of Tokyo has changed its views about how to invest its money.
Yeah, it's thank you very much for asking. And so I used to be working at Astellas for a long time, and so in Bay Area. And the difference between the U.S. and the Japan venture capital is, not only the size of the investment, but also the practice. And so to execute the deals in each other. So in the U.S., so many syndicate the venture capital in the syndicate is trying to invest in the follow-on rounds. So continuously, but in Japan, so it's a previous time, 2 to 3 years ago, everyone is trying to input the all in from the beginning and not to invest in the follow-on rounds. It's completely different between each other. And such kind of things should be, so, we should learn the US or the European VCs practices to put together the all financial, resources into one company. That's my key learnings. That's just one. And what's the?
Yeah.
Is that a question?
Well, no. I mean, I think one of the I wouldn't say suffers from, but I think there was a model in Japan. I don't when I started coming here, call it 10 years ago. It wasn't that there was a lack of venture capital. There was significant number of professors who all had $10 million companies that they'd started and they were getting to run but the way that worked, it seemed to me, was they were all the great things you could do for 4 years with the $10 million, and then you would find someone else who would give you $5 million, and it was never really driving towards, I think, the density that you have to have in order to have a self-sustaining company.
Yeah, thank you very much. That's a different part between the each regions, and everyone is trying to continue the company. So after the failure of the science, we needed to decide. It's important to continue the company when there is a kind of strategy to get the money back.
Yeah.
To venture capitalists. But if there's no such kind of plan, we needed to decide to discontinue the company quickly to get the money back and to reuse the talents and the other staff in the company to build up a new company. Yeah. That's a US practice. But in Japan, there's a kind of a practice to continue the company is the most important step. It's completely different. And the other one, so I want to mention is that relating to that, in Japan, everyone didn't understand the most important resource we need to secure is time. And everyone knows that the financial stuff and the talent resources and the science is important, but everyone didn't understand the time is one of the most important assets to input into the company. And the sense of urgency is the most important. Everyone in the US and the European venture capitalists understand that, but we need to learn that, I believe.
Yeah. So, Ken, maybe to you, in the kind of relatively short period that AN has now been kind of together, what are the most surprising things you've been seeing, and have you found that you've had a shift from what the original? I mean, you guys have been incredibly active and very productive in starting things. Are you, I think, still working through those initial theses and seeing how those play out, or have you already had learnings and now ready to even think about the second generation of your companies go?
Yeah, thanks for the question, Rob. I think the exceeding expectations, to answer that question first, was we thought we would have to do all the groundwork to attract global investors to the opportunities that we were building. And by and large, that might still be true, on average. But what we found is, sort of demonstrated by the number of global VCs in the room, the interest in Japan has sort of rapidly risen in the past few years. And so we've had investments where global VCs called us and said, we are interested in this opportunity in Japan. Can we do it together? And frankly, I think there's a lot of sort of geopolitical, sort of governmental policy things like from AMED, Ministry of Health, Labor, Welfare, and Media as well, but also on the heels of, I think it's like an average of 10 years of history here to my left. Sorry, I'll exclude you, Jonathan. But I think the works of a lot of people kind of creating this momentum is sort of crescendoing right now, and we're just sort of joining the party. But I think the global interest in Japan is only going to continue to increase. So seize the day. Right now is the opportunity. We're in the sun, so to speak. I hope Japan is sort of going to pin itself on the map, or as Shin was saying yesterday, put that big success case on the map that makes everyone stand up and pay attention.
Yeah. And Jonathan? I mean, it's the same question. It's as you've been putting things together, what's been either most surprising, or it could be most disappointing, or it could be most gratifying?
Yeah, I would agree with Ken. Yeah. One of the things that's been most surprising is the rapid evolution of the ecosystem here and the growth of it. Like, certainly Inabe-san has been a pioneer, right, in terms of creating new companies and focusing on biotech. But a lot of the companies, even though there was venture capital in the past, a lot of it were, generalist money, right, without a true understanding of how to develop assets. So pharma wasn't interested, and other foreign investors weren't really interested in what was going on here because they were all primarily service companies. And over a rapid period of time, there have been more specialized venture capital firms that have evolved over time. And, this panel will continue to get larger and larger. And I think because of geopolitical reasons and kind of capital market reasons, the pursuit for capital efficiency and sourcing high quality assets, now when you talk to pharma, they're very interested in what's going on in Japan, right? So I would say that's something that, we were trying to get on top of a wave, and that wave has definitely started right now. So that's been surprising.
Yeah, great. So maybe a last question as we kind of go back across, I reflect on, and I was just thinking about it when I was listening to talks yesterday. One of the things that has changed in the US, even in just the last 2 or 3 years, is just the size of funds. I think, we're now typically, 3 times bigger than we were, if I was going to put a rough number out. I think we're doing any number of $100 million Series A's where you really are financing companies to get, the meaningful clinical data all the way through, and you're just going to assume there's not going to be anyone else who's going to pay you at all until you do that. And I am a little worried that we're fighting the last battle in Japan because, finally we've got some momentum, and now I worry a little bit that we're not going to be doing enough of it and on a scale that's large enough. I mean, AMED, at least for all of us, probably who are here, I think changed the game in how we think about Japan opportunities, because that amount of matching money makes a huge difference. but now all of a sudden the bar may have changed again, and to stay relevant, you have to figure out exactly how to do that. It might be having working together more. I'm not sure what it'll be, but maybe as we go back across, it's useful just thinking about how, if you have a word or two of how you think about the way you want to be collaborating with international VC, what you think they bring here. And again, many of you are international VC, so I realize it's a slightly odd way to ask the question. But as you think, and it could look towards Europe, it doesn't have to look towards the US. But maybe what I know people are calling you, Ken, but for the rest of us, how do you think about the international community?
So I'll keep this short so that everyone gets a chance. Our focus has really been on building value within Japan because we believe that there's a thesis around capital efficiency and what can be built here. So as we create opportunities, looking for partners that understand what we're trying to do with respect to building, initial value here before, taking it overseas, where the larger capital pools are and accessing that. Just groups that really understand what we're trying to do there.
Yeah, thanks for the question, Rob. I think while the mega rounds continue to increase in the US, programs like AMED, I think will allow Japanese origin companies to keep pace. However, in order to keep pace with the mega financing, ultimately it has to be bridged to global investors. And I think that's kind of our opportunity and our duty to do so. But I think many of us here on stage have been involved in $100 million financings involving Japanese science. So I think the potential is there. Yeah. It just takes the work of people like us.
And by the way, I'm not entirely convinced it's a good thing, the $100 million financings. I do, I think a part of the efficiency and the mind gets focused by, I think, smaller amounts of capital, not greater capital. But you can't ignore the trend.
Yes, the more money, more problems rap song is true, unfortunately.
Yeah.
Yeah, I completely agree with you. And as I mentioned, and the other stuff I can be top on that is the alignment of the business practices with the international investors, which should be bring a great, results to Japan. So, this ecosystems, I believe, as I mentioned, and it's sometimes completely different, which should bring difficulties for Japanese, not only venture capital, but also the sciences or other industries to collaborate with the international players. And we need to learn their business practices. If it's not rational, it's okay. So we need to be aligned with the international business practices itself.
Is there an example of that you're thinking of?
As I mentioned, that we should not input from the beginning, or we should not all in from the beginning. If the company will require the following investments, such kind of stuff should be a kind of international practices and to be aligned with everyone's, presumptions. And so that's the most important, I think.
Yeah. Mm-hmm. Yeah. I mean, I think one of the long-term learnings, and I think is what we believe in the U.S., is that the biotech, especially venture-backed biotech, is particularly efficient because you're actually trying to do a relatively small number of things. You're trying to do the relatively small number of things, and if it fails, that group goes on to do something else. But that entity no longer has to be there, and I think that's a really hard, I think, lesson to learn, and you don't see a lot of it, and I do think having capital that's willing to continue to invest in those people, but on something else now in a different company, I think seeing that enough times will help.
I think this is a very great question, and I personally think we need to pay more attention to when and how the market can be shifted to the drug price being controlled more strictly, especially in the United States by the government. It might not happen 5 years, but it might happen in 10 or 20 years. So in that context, I think one of the things the Japan can provide is the capital efficiencies. Everyone knows, the Japan is such a great place to live, and the price is cheap and food is great and safe. So now the number of the Japanese researchers working or studying in the United States or other world is decreasing. But on the other hand, the number of the foreign people outside Japan coming to Japan to do the research is increasing dramatically. So which means that we are absorbing a lot of attract from the overseas researchers. So we might have a lot of top researchers coming to Japan to create the new companies. So in that case, and also we have a very capital efficient labor forces with a great quality. So I think this is one of the features that Japan needs to advertise more.
Yeah, I think Japan and US are quite interesting in a way. The opposite side, as Robert, you said, in US side, we see many of 100 million, 200 million Series A, and then always, we send applause and then congratulate. And it is great to raise a lot of money, but and then they do achieve a lot of things. But sometimes those management stay at 6-star hotel with the money, right? And so some of the capital, capital wise and capital efficiency is so important. And then on Japan side, always capital efficient, but raising sizable money is always a key challenge because venture capital wise, venture capital fund size is subscale compared to the ones in the US. So this means there's a lot of opportunity for sizable venture capitals from US, Europe to play inside Japan, so that seed find interesting science with sizable capital and then bring up, because again capital efficiency is there, and then not many players can put large amount of money into interesting sciences, and then that's what we also are doing. We used to invest small amount of money into each startup company like less than $1 million, but now we're trying to increase the size of the money of investment, and then that needs internal reprocessing, how venture capital inside us we source deals and then assess deals, and then we more organize inside ourselves and then work as a team so that we can put large amount of money to really help and then really concentrate our capital into selected startup companies what we're doing. And so I hope to see more and more Japan companies get large amount of money with capital efficiency.
Yeah, well, I mean, one thing that I think will happen, and I think it's why we've seen a number of hybrid management teams where you have significant business capabilities that are in the U.S. and development capabilities, clinical development with a lot of basic research that's done here. I do think if you want to have VCs trust writing $20 and $40 million checks, I do think, or $80 million checks, I do think they want to see a management they're used to, a more transparent, interactive management, and one who actually feel like everyone's all aligned, that we all succeed when the company succeeds, and it's not, and if it's not going to succeed, we should all move on. I think that's something that's still evolving, and it's the way to make that evolve faster is to have more trans-Pacific teams. It's a lot of work, I think, for anyone who's done it. But otherwise, I think it's going to be assets just come from Japan, and then companies end up in the U.S. And I think that'll be a less productive. I mean, it's useful and there's lots of good things to do, but that I don't think will be the highest use of all the science that's in Japan. So, what?
Yeah, a quick comment on in terms of the size of the round, maybe size of the round of particular biotech company related to the size of the fund itself. Like in the U.S., the venture capital funds are getting bigger and bigger. I'm not sure it's necessarily a good thing or not, but I think in order to compete or being a partner with the global VC, we need to get bigger, and then we need to become stronger, and then productive, and then we need to show return to the LP so that LP can trust us and then give us more money. That will strengthen the ecosystem here. So we collectively here, still a few $100 million fund. We need to become show the good result, and also we need to be strong.
Yep.
Regarding this question, my answer would be that a new investment model always born in the U.S. and grown there under a very competitive environment and spread over the globe. Then in some time it comes to the end if the market changes. And the recent giant Series A has 3 issues in my understanding. One is that is this sustainable? That's my question. If you have $100 million in cash, you can create anything. You can hire top-tier talents. You can in-license, clinical stage assets, and you can quickly develop, these assets, and you can find, some purchaser for the asset. But is this innovation? That is my question. This is something pharma company can do. So why a biotech company has to do? And my second question is that there's a shift of responsibility between investor and entrepreneur. Under classic model of Series A, B, C, D, it's responsibility of founders and managers to raise capital. But under this great, big Series A, managers sometimes, criticize investors saying, if you don't put money, we have to stop this.
Yeah.
Do you want to continue or you want to stop? It's your choice, And the managers don't really put efforts to raise capital. They really give up, raising capital. So this is a shifting of responsibility of fundraising, and is this healthy? And my third point is that this is highly dependent on active capital market. Without the active capital market, this model cannot be sustained. So I really wonder, if this gigantic Series A can continue. Japan situation is opposite, right? We are even not coming to the classic Series ABC style. As Ohori-san said that, sometimes investors don't really, keep investing in their portfolio companies. That is really, not great situation. But we really recognize the importance of frugality and creativity among the Japanese entrepreneurs. Most of them are having some farm experience, but in my understanding, cost of doing job is about 1/10 compared to the US. If you do something in Japan right now, because people are frugal and they don't take a huge salary, but they still work very hard and the quality of job is good. So, of course, Japan cannot have everything, like something US has, but, I think, this benefit of Japan system should be utilized for the global value creation.
Yeah. No, I mean, I do think one of the opportunities in Japan, because there's also not sort of a professional seed investor that I think has grown up in the US, so that the first, $4 to $8 million might not come from anything that has to do with the institutional investors. I do wonder whether there's one of the opportunities is being able to use the local capital, and AMED really helps us a lot also, to do the stuff that would have been done by the seed investors, so that there's more fruitful drugs that are ready for clinical development that might be at the translational stage that Ben talked about last week. I mean, yesterday. You get those assets have to grow, the teams have to grow. It'll be another opportunity for successes to grow. So I think we've got maybe 3 minutes left. If there are questions from the audience for any one of the members here. And I realize it's a lot of pressure, because if you don't have any questions, it means either I have to make something up or you get to go out of class early. There we go. Yeah.
Hi there, Tim Fennell from Monograph Capital. One of the things I heard from a number of the one-on-one pitches during the last 2 days was the desire for many of the Japanese companies to list publicly on the Japanese stock market. How do you guys see that as local investors as a route to exit?
You want to start, Gene? Because you had one go yesterday.
So that's very naive questions. So I wish I could have more great IPOs from Japanese science and Japanese biotech. But realistically speaking, it is still premature. As I said, the capital market is filled with a lot of retail investors who doesn't understand the true value of the science. So we need, until we have the lot more number of institutional investors who understand the science and biotech business, we should try the other way besides chasing after the Japan IPO.
Yeah, I agree with that. I think it's actually been a problem to date, because it would drive business models that, you know, away from asset development, really that pursuit of revenue generation. And you know, unfortunately right now there just aren't really the trading volumes on the public market that you know, that you see elsewhere, which would kind of facilitate long-looking institutional investors. Opportunity set is also, you know, still growing as well. So I would say, yeah, it is a bit naive and easy to say, yeah, we're going for an IPO, but certainly our fund doesn't really view that as viable exit.
Yeah, I think someone need to make positive comments, so I will do that. Do the role. You know, last year, 2 years ago, 3 years ago, this year too, U.S. Nasdaq, there are many of them still EV negative companies, right? Japan, interestingly, there are not many, close to zero EV negative company. That means, you know, maybe as they said, right, upside may be limited, or, you know, but even if you achieve some good scientific progress, because of retail investors don't appreciate much of the scientific value, but still they don't that much, you know, sensitive. They are not that sensitive to global, you know, biotech downturn, for example. So the floor is also there, and so you have some, you know, protection from the market. So I think this is a good positive side. Yet, as they said, Japan market is still, you know, underway, and then we are still working on that. But also there is some positivity there, like this protection. So I think we should think about that, and then we should keep working on how to make this, you know, sustainable and, you know, more investable.
Yeah, I mean, I think maybe we underappreciate in the U.S. how much work was done in the 80s and 90s to build, you know, an actual public market for pre-revenue, you know, phase 2 assets. I think I mean, the only reason you go public in the U.S. is because you have to. Meaning, like, if you want to develop a drug, it's a whole lot easier to develop it privately. Like, having to explain publicly what's going on in your trials, having, you know, to poke every quarter when you know it's a 2-year process. It's just, the only reason you do is because there's enough capital. There's not enough capital in the Tokyo Stock Exchange to justify that extra cost. So I think there's an education that we all probably do with all the entrepreneurs we see, and say that's not the path. Hang on one sec while he gets a microphone to you.
Given the challenge of liquidity with Tokyo Stock Exchange to list the biotech pre-revenue biotech company here, I wonder what is the appetite? Why there is not a lot of like Japanese pharma acquisition of Japanese biotech? I can, you know, understand for China and Korean, their pharmaceutical companies have not had enough, you know, track record, a long history, revenue, or global expansion. But I feel like this is a unique aspect of Japanese ecosystem, but we are not seeing that. I mean, for returning capital to LP, for US and Europe, I think biotech companies and VCs benefit from the acquisition ecosystem. I can understand from pharma perspective because I'm from J&J. I invest in across Asia Pacific and also US. I can understand, you know, from global pharma perspective, it is difficult to acquire Asia Pacific companies for various reasons, right? But for Japanese pharma acquiring Japanese biotech, what is the hurdle?
I can touch on that quickly. So a friend of mine who sits on a board of a top 5 Japanese pharma said they acquired something, and they probably, from Boston, paid probably 10 times more than a similar asset that was being developed at Kyoto University. I'm like, how does that make sense? And they're publicly traded. And so his response was, if I bought the one from Kyoto University, my stock wouldn't move because investors in my stock don't believe it's as valuable as the one from Boston. So I'd rather pay 10 times as much. And I think that's the reality of even the retail investors in Japan don't believe in the value of the assets, which I think is an arbitrage opportunity for people like us.
But are there similarly valuable assets kind of like that? I'm not sure if that's really good. Is that really the reason?
I think there's so many things you can double click on that, Shin. I totally agree. And the -3 minutes that we have, I was trying not to expound too far on it. But all I wanted to add is that most people don't immediately consider the publicly traded company perspective is that you do have to appeal to your stock base, even in the short term, not just long term.
It's an irony that you can pay more for if you're a public, big biotech company or big pharma company, you'll pay a 50% premium to the public price. Someone set a price for you, and so you're protected. I think when you buy a private company, the public company can often get hit. I have the please wrap up sign. So I think with that, I want to thank the panel and thank the audience, of course, and the organizers for putting this all together. And thank you for your attention.
Thank you very much, Dr. Wiskov and all the panelists. Please give them a big round of applause again. This concludes the Booth C panel.